Welcome to HoneyChildListen, where the mic becomes a mirror and every story matters. I am Katrina, your host, and this isn't just another podcast. This is the living room, the kitchen table, the sacred circle of good girlfriends coming together to sip and spill the tea on life, love, legacy, and everything in between. So grab your glass, get cozy and comfortable. You're with your good girlfriends now. And don't forget, we want to hear from you. Got a story, a question, or some tea you need to spill? Go to HoneyChildListen.com and drop a message in our inbox. Be a part of the conversation. We want to hear from you, the community. This is HoneyChild Listen. Let's have some fun. I want to personally thank each and every person in this room for coming out tonight. You could have been any place tonight. It's a Friday night. It's Good Friday. But you chose to come here, and I really appreciate it. You saw the title of what we were doing, mental health. A lot of people run from it, but I appreciate you running towards it. So again, thank you. Our listeners can't see the people here in our audience, but we have a lot of people here to learn about mental health. I will begin by introducing our panel. We'll start with Dr. Walker. Dr. Shelley Walker, would you please introduce yourself and tell us a little bit about your background?
Yes. Good evening, everyone. I'm one of the owners of Theories of Life. I'm a marriage family therapist, and I have my doctorate in educational psychology, along with being a motivator speaker. On my side gig, but really is my real gig, is that as long as I do still have it, I'm a federal employee for the Navy, helping individuals transition from the military. And the last little accolade outside of being an author is that I am so happy to be the queenie to my grandbaby Aria.
Oh. Okay, next we have, let's go back on this side. We have another Walker, Miss Alicia Walker. Miss Alicia, would you introduce yourself and tell us a little bit about yourself?
Hi, I am Alicia Walker Smith, also known as author, coach, and speaker. My side hustle is real estate. I've been a realtor for the last 15 years, and I am also a businesswoman and owner, and I'm happy to be here to join the HoneyChildListen Podcast. Thank you for inviting me, and I am proud to be here with so many wonderful women.
Did you mention a relationship coach? I'm sorry, I missed that.
Yes, I said I am an author, speaker, and coach, which means I help people on their journey to transform into healthy relationships, whether it's personal or professional. So they consider me a relationship coach. Thank you.
Thank you,
Thank
Miss
you
Alicia.
for joining us, Miss Alicia.
Thank you.
And I'm sorry, I did go out of order. This is my co-host, my best friend, my baby sister, Ryan. Ryan, would you please introduce the next guest?
Yes. I would like to introduce to you another Walker, Miss Lisa Walker. Can you introduce yourself to the people, please?
Okay. I thought you were going to talk about yourself. Okay. Good evening, everyone. I'm Lisa Walker. I'm currently a business partner to Maryland Express Tag and Title, where we do MVA tags and registration. We have 7 locations. Come see us. I'm also a retiree twice from the federal government as an IT specialist at Social Security. Early retirement, thank you. And a military retiree. I retired back in 2006 with 22 years as an Army Reservist first class. Sergeant first class.
Yeah.
So I am just honored to be here, and hopefully you guys will enjoy what we have to say, and be looking forward to your feedback as well.
Thank you. Thank you. We have a next guest.
Last but not least,
Miss Elena Mills.
Hello, I am Dr. Alina Mayo Mills, and I am a family nurse practitioner and the owner of Valet Health. I do concierge medicine, So I go to people's homes. I do house calls and telehealth, and this all stemmed from treating addiction in the office. So it made me make a change.
All right. All right. Thank you, Ms. Mills.
All right, thank you to all of our panelists. We do appreciate you coming out, spending this time with us. I also want to mention that we have a few, as Alicia mentioned, she's an author. We also have another author, Dr. Walker. I do have their books around the room. You guys take a chance to take a look at some of the books that we have displayed. So now we're going to get into it. And we're going to just pretend like you guys are not here. And we're in the living room and we're just having a kick it conversation about mental health, literacy, and advocacy. All right, so we're going to start with Dr. Walker to start us off with our conversation. Dr. Walker, what does mental health literacy mean, and why is it critical today?
Well, in answering why is it critical today will actually give you the answer. So when you think about literacy and think about how today is society and everything going, you would think with everything that we got, all the technology, all the Google and everything, mental health would not be so stagnant and behind. But unfortunately it is, because with us being able to be behind the camera, behind the scene, more and more people we are finding out are not knowledgeable about mental health and mental health disease and awareness of what's going on. So outside of them not having enough knowledge, also it's tied into their beliefs. So if anybody who's probably my age, we seasoned, you always know the family tells you not to air out your business. So if that's ingrained in their religion, if that's ingrained in their belief, they're not going to seek that knowledge. So what we need to do in order to make sure that they stay accurate, that they stay knowledgeable, is that we have to provide more information when it comes to mental health. Then that way, by providing more information, we'll have those more positive outcomes. We can change the attitude opposed to having a negative attitude. So we most definitely cannot stop, because you would think with all the stars and all the athletes and everything coming out about their mental health, there's a lot of people in rural areas, low economic areas, who do not have the information. So we do not assume that they are adequate, knowledgeable about mental health, and that they'll seek health professionals.
That brings me to, I'm glad you said that. I want to pick up on the whole stigma thing that you just mentioned, right? So to our panelists, how does stigma, especially in our Black and brown communities, impact whether people seek support, especially our Black men? Who would like to answer? Anyone?
I can answer.
Okay, thank you.
I think specifically our brothers, and it relates somewhat to our military folk, which I was going to say. We're built to be tough. We built to be, the protector. We built to, not to show any signs of weakness. And when you speak, unfortunately, when you speak of mental health, people think of it as a sign of weakness. Mm-hmm. There's a problem. There's the stigma attached to it. You're going to be name calling. So, and even with other ailments, a lot of our Black men, it's hard to get them to go to the doctor on a regular basis for physical ailments. So mental is going to be an issue, because it's seen, they have to put on this exterior front that, I'm tough, I can handle this, I can't show signs of weakness. So I think that's one of the problems that we face even in our community, not just Black men, this in our community, period, because, we were built to be survivors, to take whatever's given to us, we can handle it. So you're going to have a hard time for people to accept that, there's a mental, you need to check on those things.
But what can we do? What kind of advice can we give? I don't want to single out the men, but our Black men and women, what is it that we can do to make them feel more comfortable coming forward and saying, hey, I need help. I'm having a problem with whatever it may be. I'm having a problem with being a father. I'm having a problem with being a mother. What is it that we can do to kind of make them feel more comfortable coming forward? Anybody?
Well, that starts kind of in the home and in the community, right? Because we have some beliefs, and as Dr. Walker said, we have some beliefs that are embedded in our community. One, it's that we could not afford psychiatry or psychology at one time. It wasn't available for us. Let's just be honest, okay? Health insurance alone was not available for us. So coming out of your pocket, paying for something that your parents tell you that you can get over, you know, take a nap, get some rest, suck it up. You know, they don't see the value in that. So you have to start to change the conversation, right? And it starts very young, where their feelings are very valid. They don't have to disregard them or act as if they're whining. And when I'm speaking for men, it's a whine. I have a son, and I have to check myself sometimes, right? Because if he comes with certain moods, attitudes, or questions, I have to realize that I can't repeat what I've heard in the past. His feelings are valid, and I have to recognize that, right? And don't try to downplay it so we don't have to have the conversation. So I think that the stigma, getting out the education, because we see mental health as schizophrenia, hallucinations, manic behaviors, but that's an extreme, right? There's a spectrum of mental health. So once people are educated about that spectrum, and they realize that their brain is just as valuable as their heart, the medication they take, take medication for, their liver, their kidney. When you realize your brain is just as important, then they may prioritize that, right? They'll prioritize mental health, right? And it's not just the schizophrenia, and it's not just the hallucinations, and it's not bipolar. It's not those. No, those are not extreme diseases. Those are spectrums, but it's not that. There are.
Let's talk about anxiety, depression, autism.
There you go. Right.
Yeah.
So bipolar is huge. Depression is growing. Anxiety is growing. All of these are manifested since COVID. So I think that's where the stigma, we have to educate, right? And when you educate, stigma decreases. We have a blueprint, many blueprints, but HIV is our biggest one. So it's not new. We can do it. You just have to invest and see the value in it.
Well, there's two things you mentioned. Well, there's one, as you were speaking, when you were talking about your son, I started to think about, and then that's the other thing that you said, depression is growing. So when you spoke about your son, I'm thinking about men crying and them having an issue with wanting to cry. They think that they're weak if they start to cry in front of people, right?
As if they're told that
That's true. That's true. Right? So we need to let them know that it's okay. It's okay for you to cry in front of me. I want to see that vulnerability. That shows me that you're strong. That's number one. And then I also want us to touch on the depression part that's growing and why it's growing and what's going on today with our government.
I don't know if it's growing or if we're just doing some better screening.
Right. Awareness.
Right. I don't know if it's growing.
That's the
we're
mental,
screening.
Yeah, that's the mental
awareness.
That I was talking about, is that you have to be aware of the symptoms. You have to be aware of the signs that are going on. But as I started off saying, a lot of our problems and issues is society itself. The more, as my mother say, we're getting smarter but dumber, because when we hide behind things, that's when the bullying come in. So there's so many different facets of depression, mental health going on, because we do not know what's going on with one another. We don't know what's going on with our children. We just had another shooting, and we found out that that's a young man who was 20 on a college, and his mother is a sheriff. So that lets you know that there's not enough information out there, and we're not checking in enough, because there's a difference between moods. There's a difference between depression. There's a difference between stress. There's a difference between I'm tired. Yes, tired is not the same as being burned out. Now, when you start hearing people say certain words, you have to really check in and find out, is it tired or is it burned out? Because then when we go back, as you said, to the family, those are just like words that, oh, I'm tired, I'm burned out. And, oh, okay, well, do this, do that. No. Find out exactly, are they tired? Are they burned out? Are they stressed? Because if you go in those sequence, then yes, you start to lead into the depression. And then they start being reclusive, hiding behind, masking that we all see going on. And then going back to the men, I have 5 brothers, 5 girls, 5 boys. My brothers raised me. My brothers were my protectors. And so I take on a lot of masculinity. They told me, suck it up. What do you want to do? If you want to be with us, there's no crying and everything. So you can imagine now here, I'm a grown woman, children, grandbabies. I have the same attitude to them, so I relate a little bit different. But I know where a male perspective is coming because my brothers raised me to be that rough and tough. They're like, we're not going to always be here for you. You suck it up. What do you want to do? I want to be with you. Well, if you want to be with us, there's no crying. And that's the way they were taught. So I'm the baby. I'm the baby of 10. So that means my oldest sister is 14 years older than me. So you can imagine what was going on in our household that you're not supposed to talk about.
Mm-hmm. Well, I appreciate that. And where you led us to was a question I wanted to ask. For those without clinical training, you mentioned, a lot of stuff that you just said, but what are some signs, specifically, some signs that someone may be struggling emotionally or mentally? What are some signs?
That's a great question.
So initially, if you're mindful, you're paying attention, you'll see difference in mood swings, irritability, changes in behavior, period, right? Mm-hmm. For adults, this could be shown at work, it could be shown at home, it could be shown with their kids, it could be shown in something social that they like doing. I'll give myself for example. I love to swim. So if I'm not swimming, then something's going on right with me. So people are checking in. My swim team will check in with me, right? If I'm irritable at work because I'm doing a no-carb diet, they're checking in. Why you snappy? Oh, I ain't had no bread in about 4 days. Like, they're checking in, right? So you're paying attention to that, and you're not brushing it off, right? Especially when it's consistent, right? Something that's over a week or 2 weeks or something like that. You're mindful of that, right? And our children present different, right? You can see them just as happy as they want to be, and then the next thing, they are withdrawn, or their mind is somewhere else. Mm-hmm. They have these vague complaints about aches. Mm-hmm. Stomach is one. Mm-hmm. Is a big one. That's good. Headaches is another. Mm-hmm. And this is for our kids, yeah. Right? Mm-hmm. And you'll see them withdraw and get snappy, or they're hanging with people, right? Their friends have changed. Their cohort has changed. Mm-hmm. Their grades look different. We can't just mull over that, right? You got to be mindful of it. So with us as adults, if something's going on with you, mm-hmm. I'm mindful. I'm looking. Okay. And then, it better snap back quickly, or we're talking, right? And I'm checking in. And you may not even know I'm doing it, mm-hmm. right? For me and my patients, 80% of my assessment is just sitting here looking at you and talking to you, right? Mm-hmm. And then I have screening. But that's how I check in. Okay. Right?
I like that. But how about this? For our audience and our listeners, how should a person approach a friend or loved one who may be experiencing mental health challenges? What are effective ways to talk to someone who may be resistant to getting help? Because a lot of the stuff that you said, right? I have a friend who I say to them, hey, look, because she showed that she's, some of the signs that you mentioned. And I said, you might want to talk to somebody. I'm fine. No, that's not it. I'm fine. Ain't nothing wrong with me. No, but, I'm seeing, you're doing this, you're doing that. You might want you to just talk to someone. So how do I approach if I keep telling them, hey, you're doing this, you're doing that. You might have PTSD. I'm not a clinical therapist. I don't have the background. But being around people like that, I kind of can pick it up. But I want you to go to a professional to get diagnosed. So how do you go to a person that
there's it's called mental health first aid. Anyone can become certified. Okay. The first thing you do if you see someone in crisis is you try to figure out if it's an emergency, right? Mm-hmm. If I need to call 911, are they harm to themselves or anyone else? Are they suicidal? That's the first thing you do. The second thing you do is you listen, because a lot of times they just want you to listen. They may not want your advice in that moment, because in that moment, that's not what they're thinking about.
But I'm not the professional. I want them to go get help.
I understand what you want, but hold on. But you gotta understand that what you want is maybe a little selfish.
I'm trying to figure out how can I get them to go.
That's what I'm saying. But you have to listen to them, because maybe sometimes it's just that it's listening, right? Okay. And then you give advice, right? You may give some encouragement, right? And then you encourage them to seek either professional help or do some meditation, find a hobby, something positive to get into, right? But I don't want them, they hear you, they've heard you already. I don't want you to push them. Okay. So being there and listening, and then maybe say, because I talked to my therapist today. I mean, just little stuff like that. Yeah. I'm not saying that you have to. Right. I'm just telling you that I did.
No. Let's normalize this. Right. It's okay. Right. Just like I'm going to get my hair done. Hey, I'm going to talk to my therapist this weekend. My psychologist, my psychiatrist. Don't say, I'm going to see my coach. I'm sorry, Alicia. But yeah, sometimes people say, I have a coach. No, you don't need a coach. You need a psychiatrist.
Well, the thing is, I think you need someone professional.
Yeah, you got to stop.
You may need both.
The main thing right there is you cannot judge.
Absolutely.
You cannot judge or tell them. They don't want you to tell them. They want you to hear them.
Absolutely.
So you need to let them know it's okay to talk to me. Mm-hmm. I'm talking to you. I'm not talking at you. Because the minute you start throwing out the judgment stuff, they already shut down. Yes. If they didn't shut down already. So you do not judge. You do not blame. You just say, I'm here for you. What do you need me to do? But the main thing to do is set healthy boundaries, because you do not want to become an enabler. A lot of times we enable people to continue because we're the caregiver, we're the helper. And so it helps me to keep you the way you are. So sometimes we have to check in with ourselves before we can check in with somebody else. But if you don't have those skills, you don't have to have those skills. We all know you go to the hair salon, go to the barbershop, go to the, the bar and everything. Just be careful with spirits. Just be careful with spirits, because you don't know what's going on. But the main thing is to let them know that they are not alone. Mm-hmm. They're not alone. I'm here to help you. Where can I help you? To your limitations, and not be on to where you help induce them to continue going down that road.
So why? I just want to say one thing, because you said they don't need a coach.
No, I didn't mean. No, I'm sorry. Not that they don't need a coach. I'm sorry. That's not what I'm saying. But some people try to, what do you call it? Sometimes people, I can't think of the word for it. But instead of going to a therapist or a psychiatrist, I'm going to see my coach.
But you. I want to see the first lady. They don't have. I'm sorry. You can't have
You need the coach sometimes for certain things.
They may not be clinically trained.
Yeah.
But you have to meet people where they are. And sometimes people may feel comfortable just talking to their pastor, or may feel comfortable talking to their coach without going to a therapist. Now, coaching is, people utilize coaches all the time, because coaches reinforce, positivity in their life and help them try to obtain goals successfully. Sometimes people don't want to seek out coaches for that very reason, because you said, it's not therapy, or it's not clinical. But most coaches are like your biggest cheerleaders. Mm-hmm. They're going to push you to do the things that you think you cannot do.
True.
They're going to be a listening ear when you need somebody just to listen to. They're going to send you customize a plan for you to make them feel comfortable with speaking to you, to say, hey, I got your back. I support you. And a lot of times, like Elena said, most people just want to listen to ear, a shoulder to cry on. They don't want your input. You know, a lot of times they don't want you to speak. They want you to listen. So that's all I'm going to say. And as a coach, I'm there to listen, but I'm also there as a guide to help them get to where they're trying to be in life.
And I think that when a person, it depends on the level of mental challenges that person may have. So
Correct.
yes, if they need a push into the right direction to do something, definitely. But if they're really suffering from something, a chemical imbalance, I think that they should go see a psychiatrist or maybe a psychologist, but they also need that coach for the encouragement and the direction.
Yes, because a coach can also recognize when a person is going through something mentally or emotionally. And sometimes as a coach, we can say, hey, you might want to seek therapy. And it depends on the relationship you build with your client. If they feel comfortable talking to you, I mean, I'm not a therapist, but as a coach, I'm there to listen and to try to help them as best as I can to get them to where they're trying to go in life. And sometimes the listening ear is all they need. But if I think they need therapist or professional help, clinical help, then I would say, hey, go see a therapist. Hey, reach out to Elena.
That's good.
For your anxiety. Call Shelly for your counseling.
Yes.
You know.
Okay.
Because they may not listen to the friend, but they may listen to the coach.
That's right.
Yes.
That's right. Well, you mentioned pastors, right? Going to the church. I will say this: in the past, when you took your problems to the church, what they say, we're going to pray that away. That don't exist. You're not receiving that. We're going to pray it away. But now I am seeing some churches, I'm not going to name names, but I love my church. They're changing. It's more so now, hey, go see your psychiatrist and take that medicine if you need to take it. So, times are changing. Times are changing. One of the things I would like to move into is, go ahead.
Jump off of that, because a lot of the ministers and pastors are dual-headed now. They're getting the psychology degrees, the mental health degree as well, so they can be there and be that advocate as well. Or what they'll do is they'll elicit one of us to come in to provide that information to it. So yes, that's one way of getting smarter and breaking that taboo of that, mental literacy that's going on. So baby steps, but we getting there, but we got to do a whole lot more.
Definitely. One of the things I want to move into is, how does individual mental health affect the quality of a relationship? And I'm not just talking about between men and women, girlfriend to girlfriend, friends, family. How does mental health affect those type of relationships? Would you guys like an example?
You have a lot of examples.
The one thing is, we have to be careful about what we do and what we say, because there's a gamut of everything going on in everybody's life. And just because a person has a mental, whether they're truthfully diagnosed or not, or somebody think you're diagnosed, it may not have anything to do with it. It may actually be we just are not bonding with one another. But if it happens to be mental health, if there's no support, then that could be the issue. So with me, I sit there, just like you said, I sit there and I listen. And then after I heard what I needed to hear, then I reflect. Then we root out. It's called ruling out. Ruling out what actually is the problem. And the problem has nothing to really do with the mental health. But if there is a mental health issue in there, then yes, then we go through the stages, we go through the steps, and then of course that's going to be a little bit more, because then that requires treatment plan. That means if it's a couple, I have to pull the person away. Started off couple, now it's individual counseling, because I have to focus and get this person healed and safe and comfortable, and then bring that person back in order to make them gel. So it's a matter of finding out what is the root of the cause, and not automatically say that it's the mental health. It may not be the mental health. It just may not be a good connection.
Well, that's good that you mentioned the counseling of couples, because how can relationship patterns passed down from our families And past relationships influence how we show up emotionally in romantic partnerships. So, like you said, you counsel couples, and then when you find one needs your attention more than the other, you pull that one in and say, "Hey, let me." So, how do you guys see that certain? I'm just gonna say it. When you're dating, you leave one relationship going on to the next one. You may have been cheated on in that past relationship, or I don't know, something, and then something from your family history. There could have been a bipolar mom in your household, and the way things took place in your household, you may thought that it was normal. So now moving forward, you have those same personality traits that you think is normal. So how does that affect your relationships moving forward, in your current relationships? How does that, your mental state, affect that?
I think everybody pretty much heard the patterns that we're saying. So everything is rooted in the family. When babies come out, they're blank slates. We all were blank slates. Somewhere down the line, we learned it.
Mm-hmm.
I'm going to say this again. I'm redundant for a reason. It's not always the mental health issue going on. But most of us do learn from our parents or who is our guardian who raised us, and then that's how we normally will relate. If there is some issue of mental health going on, does that automatically mean the next person is going to repeat it? Not all the time. People break that stigma. It's really within it. So it gets to that point where it's a chicken or the egg, whether nature, versus nurture and everything like that. So for me, and as you see, I'm very cautious of what I say because I don't know who I'm talking to and who I'm not talking to, but I always have to find out what it is before I point a finger to say this is what it is, especially when it comes to any mental health. So I can do all the gamut of diagnosing and everything, so I don't readily run to that right away until it's disclosed to me. But everything starts within the family, whether or not somebody, normally is going to vibe with them. If you didn't have the loving mother, does that mean you're not going to be loving? No, that doesn't mean. But there may be some traits where a person will pull back, become a little bit more cautious, a little bit reserved and everything like that. So I evaluate everybody individually when they come through that door until I find out what the family pathology is. Then once I do, we talk about it. And then it's up for them to agree whether or not I'm right or wrong, because this is still them. Me listening to them and them just trying to find out a solution of what's going on and everything. But normally, whatever we learn is normally how we're going to relate to one another. If you have parents, family, siblings who are not trusting, of course it's going to be within, but it's not always.
Since you mentioned that, and that I do believe a lot of things are learned, but I do know some individuals who parent had some mental issues, and the daughter had some mental issues as well, maybe not as severe. So how do you combat that? Because there is some DNA there that shows that they may have some symptoms of the parent. So how do you, you don't want to judge. At the same time, you see some similarities there. That's genetic.
Yes.
So, so it's kind of difficult to distinguish. Of course, you said listen, and I do believe in not judging a person first, listening to what's going on. But if you, especially if you have privy to the information that the history is there, because you may not have that, may not know. If you're only talking to the daughter and you're not knowing the mother had some similar issues, it's kind of hard to, distinguish. So how do you, that's one of my things, because you don't want to say, oh, you just like your mother. You can't say that. You can't do, but how do you deal with that?
Where the education piece come in. So for me, I have to educate. So I'm doing two things at one time. I'm up here doing assessment, but I'm also educating as well. And then the main thing is I have to listen. So that's in the process of an intake. A person come in, they start talking, you're listening and everything, and trying to get that person to provide as much information, well, actually really build a relationship, because I'm not going to get everything. Sometimes I do. Yeah, I have. Sometimes you get a lot on that first one. It's like, you do know we got an hour. But, so like for schizophrenia, yes, we do know that that is inherent. Not all the time, but the likelihood and the statistics on it, yes. So if those things are disclosed to me, then yes, we do go down that, and then that's where the education piece come in. I am a therapist, I'm not a psychologist, so then that's when I start reaching out to somebody, because they may need to be on medication or something like that to stop it. The main thing is about prevention, educating them and preventing and getting help for them and having them be able to go through the process. So when it does come into that, no, you don't want to say, you just like your mama, you just like your daddy, you don't listen to me. And then sometimes they are like their mama and their daddy, but not until we find out and everything. And then that's what normally what I will do, and that's what normally most people will do. We got to find out, once again, the family pathology. And if it's there, then yes, I will talk about it. But if I don't know, I have to be careful until it's disclosed to me.
Okay, wait a minute. I have a question.
I'm going to interject. Learned behaviors are very real. Learned behaviors are very real. So if I'm scared of spiders, this is not psychology, but if I'm scared of spiders, then I can see that my daughter is now definitely afraid of spiders also, right? That phobia. So that phobia, I know probably stem from me, right? Roaches, spiders, I don't like them. Right?
Probably across the board.
Right. So learned behaviors are real, and they come through sometimes through trauma. So, a lot of times, I know, unless it's these diagnoses that I send to a psychiatrist, this could be a model where you have to change beliefs and behaviors. And that's why she said, like, getting into some of the family history, especially when they're younger, because, like, it doesn't come from nowhere. Wow. And trauma can send children and teenagers into fight or flight, and they're doing things that they wouldn't normally do that may look psychotic, right? Or look behavioral, but that could be survival. So that assessment is real. Mm-hmm. I don't assume that everyone that has a mental health diagnosis that it's genetic, because many times it's not. A lot of it comes from trauma also.
I have something to say. When you asked your question, did you ask your question for her to tell you how she will resolve it, or how should you address that issue? Because it's something that you're dealing with inside of your household, at the job, or what have you. Because you don't have that degree. Right. So you don't know those steps to take. Right. So for you, inside of your home, or you dealing with this individual, is listening, paying attention. You said you don't want to judge, but I hear judgment. You see what I'm saying? But it's listening to the person. Get to know that person. Get to understand that person. If there's things that they're doing that you don't understand, research it. Look it up. See how you can help this person on your own, because you're not a psychologist. Right. You know what I mean? So maybe you can give her some tools and what she can do to help her in that situation, dealing with an individual like that.
Yeah, and just to say, I don't say anything to her, or, I don't make any judgment calls. It's just my internal thinking that, you show some similarities to, not totally, but, but I let her speak, and she handles things the way she wants to handle it, because, it's hard talking with friendships when you're close to a person. Like you said, it's really hard to try to give that type of advice, or even to make any suggestions like that. So all you can do is really listen to me. Unless it's really severe and it's a problem, and that's all I do.
Well, I'll just tell you that's a good friend. So you're listening. That is so key. No, you do not have to have a degree. You don't have to be licensed or anything. You have to listen and do the encouraging to get the individual to somebody who can, who doesn't have the dog in the fight. Because that's the very first thing I can say. I tell them when they sit down, I told you, it's like, I'm the new PhD. I'm not going to sit here and allow you to waste my time, and I'm not going to waste yours. How can I best help you? Because a lot of times people aren't ready for that help. But you being that friend, if you're talking to for somebody else, you have to listen and just keep on encouraging. That's when you know the time to stop and just keep on reminding. But like, did you go see and so? I met she go by S.L. Walker, but she can probably help you. You slide stuff in there sometimes, and I know Katrina and I talked about it a lot. Sometimes what we have to do is that we become the best advocate by getting somebody in a place they need to be without them knowing it. So I think right here, what we're doing, we're getting people in places where they don't know that they're getting help. Make sure that it's something that they, just like in church. I don't listen to everything the pastor say, but every now and then there's something he says, and I'm like, whatever is outside of the relationship comes into the relationship. So you just may have a person who's not a communicator, and you are, and it has nothing to do with trauma. So for me, and what we teach the children, especially when I was at the youth center on base, is it was 1, 2, 3 magic and timeout and everything. And depending on how that person was raised and everything, they may have been told, okay, just shut yourself down, push yourself away, and that's their best way they handle it. Now, when you have the opposite, I actually have that going on right now. Somebody who's the communicator, they're like, well, why aren't you talking to me? Because I'm shutting down, I'm pushing myself away. So when those situations and those dynamics happen, I have to find a common ground, because a person can't always go run away. Some things need to be talked about and discussed and resolved. And then the one who is the over communicator, I have to pull them down. I actually had to do that. To say, are you listening? Because if you're talking, you're not listening. And sometimes it takes just to listen. So I always make them do the opposite role. Oh, that's fun. That's fun. I can spend like 30 minutes when I put them in the opposite role, because the one is just itching, ready to say something. But no, I need you to be quiet. Put yourself in that person's shoes. But when you do have situations that are trauma, a person is going to take that to the next relationship until they learn how to break that cycle, if they want to break the cycle. So when they come in, I have to find out, once again, what's going on. What caused this? Where did the trauma start? Why did the trauma start? Was it the other person, or was it actually you? But you got to remember, we all have some type of trauma going on in our lives. So we can't deem somebody else's trauma to project, to make us look better, because we may be going through it too. But it's easier to pin the person who's quiet opposed to the person who's always talking. So then that's when we do the real reality check. That's when the tea really start flowing. But like, wait a minute, what's going on you? And sometimes I have lost people. I'm not here to validate anybody. You may have listed me, you the IP person who come in, but I'm not here to be on your side. I'm not here to be on that person's side. I'm here to listen and tell you that, yes, there's no right, there's no wrong. But in this situation, you are the ID person, not the person you felt that you wanted to drag in. And then as you see, sometimes couples become individuals, individuals become couple, because it's a matter of finding out where's the issue at. But if there is some trauma, especially when it comes to trust, when it comes to hurt, relationships, infidelity, oh yeah. But then once again, we gotta find out, why did you do this? Not just because she was looking good, he was looking hot. Something caused you to do this. What happened? And yeah.
If someone doesn't communicate effectively to me, if they don't have good communication skills, I shut down. I walk away to protect my peace, because I can't hear you screaming at me. I'm not listening to your words. I'm listening to your tone, and I'm listening to your gestures.
But what if they're not screaming? What if they're just saying?
But that's what I'm telling you.
Yeah.
Effective communication for me.
Yeah.
So if they're not screaming, I'm listening.
Okay.
But I'm not hearing you if you're yelling at me.
True.
I'm not hearing you if your body language was. This is me personally. I'm not talking about in a professional stance or anything like that.
Hey, we keeping it real talk. Come on.
I'm talking about how can I communicate with you if you're that emotionally tied up in that moment? Only thing I can do is listen. I'm not I may not respond at that moment. And I walk away from it,
because
so
if
I
you
can
respond,
process it.
They probably can't hear you anyway. Because they're yelling. And
So whatever that's about.
Yeah.
If it's in the office, a lot of times it's not about me. They want to meet me outside and stuff like that. But I know it's not about me. I'm just the person. I'm just the vessel, right?
Yeah.
So yeah, I protect my peace also in those situations. So a lot of times, if somebody shuts down, it's not necessarily a bad thing. Right, when you're trying to communicate.
Yeah, I'm glad you said that, because I want the community to know this and to feel this. And a lot of our people in different professions, officers, doctors, people that deal with the public, I want them to understand that if a person is irate with you and they're yelling and screaming at you, a lot of times it's not about you. So I want you to get out of your own personal feelings and thinking that someone is attacking you. And you tell me if I'm wrong, right? And kind of sort of like you guys were saying, just listen to them, because that's all they want. Don't be combative. They're yelling and screaming because maybe they just lost their job. Maybe they just had a death in the family. It could be anything. And you feel attacked because of the things they're saying, but you have to remove yourself, as you stated, remove yourself and allow them to have that time to vent.
Okay, now if this is in the office,
Okay. Let's get with it.
If this is in the office, you're absolutely right?
Okay.
However, we have to take care of ourselves.
True.
As clinicians. All right, we have to take care of our mental health also. We have to decompress, right? So where does that energy go when you leave work and you dealt with all these personalities? And you take that energy in. So you have to learn how to decompress and so on and so forth. But at work, Trina, yes, you do. I've seen many people leave. Okay, so I'm in Anacostia for primary care. I deal with addiction and I deal with chronic pain. So I get a lot of mood swings. I get a lot of irritability. I know that it's not about me most of the time. And sometimes it is about me because I'm evidence-based and I don't necessarily step out of that in certain situations. So when it comes to that right there, it's really up to this professional that you're dealing with and their background also. Because I've gone to see providers, I've gone to see doctors and felt unheard. Right? Yes. I don't tell everyone what I do, and felt unheard and unseen. So I know bedside manner is a big thing also. And it's not always the thing, but it's a big thing. But in the professional role, Trina, I think many of us know that it's not about us. But you have some people that are in the wrong job, in the wrong place.
At McDonald's do the drive-through? I don't think so. When they be coming at me, no, I know But I know other people, it's like, why she so mean? Why she? And I'm like, maybe they're having a hard day at home, or maybe they just mad that they have this. Who knows? But what you just said, I want to touch on this because, like you said, as a clinician, as a psychiatrist, psychologist, as a coach, you guys have to protect your peace. So my question is this: is that why we are facing a shortage of mental health professionals or Black doctors in your profession?
Well, I think that right now, I think we may be facing a shortage because we are screening better, right? So we're diagnosing more, and so it's not enough. But then on top of that, many people want someone to look like them, that they could possibly kind of have some empathy towards their situation and may understand the culture also, because I've had other people work while I work and leave within 3 months, within 6 months. And it doesn't matter the ethnicity, right? It just has to do with their personality. Okay.
So go ahead, I'm sorry.
So there is a shortage. We know this because we're diagnosing more. We have better screening tools. There's a great screening tool they use in California. I hope it comes to DC and Maryland one day. It's called ACE. And Tammy and I have been working, Dr. Parks and I have been working on this for a while, but it's called ACE. And
Can you tell us what ACE stands for?
So ACE stands for Adverse Childhood Experiences. So they're doing it for adults. It's a 10 question, 15 question. You can make it, they have different screenings, but they started off with adults, and your score on this questionnaire will determine if they're giving you a referral to psychology or psychiatry. What we're trying to do is bring it into the schools so that the social workers and the psychologists in the schools, the nurses, can also start to administer these questions and do referrals also. Because usually I'm one of the first points of anyone that has a mental health issue, and they may not even know it. Right? So we diagnose these through screening tools. And the number that they get on certain screening tools will determine if it's something I can handle alone, or if it's something that I need a partnership or collaboration with. Right? So yes, we need more psychologists and psychiatrists of color. We need more doctors of color. But that is so complex because reimbursement and the way things are done these days, it's not very encouraging for someone to become a doctor. You work hard, and there's a lot of mental and all of that with it. So yeah, they rather, invest crypto.
We do have a question in our chat that I'm going to go ahead and read. No, can't do that. Came from one of our listeners. I'm not going to put them on the spot like that, Brian. Come on now.
I'm so sorry.
So, please inform the audience of the professional terminology for clinical positions, i.e. counselor, therapist, psychiatrist.
Well, they're synonymous in the same. The only thing different between a psychologist is that they go to school to be able to minister medication. So I am not a psychologist. I tapped out. I'm dyslexic. You don't want me to give you medication. So I stick at my point where I am that therapist, that counselor, but I am able to diagnose. So those are some of the things that you'll hear interchangeable, and that you really need to know the difference between a psychologist, a therapist, and then even with coaches. Once again, everything is synonymous because it's really who you have the relationship with. You can have the relationship with me, but like you said, I may need to collaborate with somebody who can minister medication. So then that's where we have those consent forms that come in to say that you can talk to this provider, you can talk to that provider, so we can collaborate to make the best treatment plan for one another. So that was an awesome question, whoever the person was. But she's going to find out.
That's important also, because people think that if you go to a psychiatrist, and it's set up this way too, that they're going to prescribe meds. And everyone doesn't want medication. When I lost my husband, I didn't want medication. My son was very young, so medication was out. But I needed that therapy. I was there 3 days a week like it was a job until he kept on. And then I felt like I was being kicked out. But so some people medication is not always it. It's behavioral. It's learning coping strategies and tools and getting those things to get you through the day. Being able to recognize it when you face it, because these are feelings that you have, right? It's the energy that comes. And if you can recognize it and you can redirect, right? Because how we think is how we feel, and how we feel is how we act. So if we can change or sometimes break that cycle, then your outcome can be different. So they don't want to see a psychiatrist. You say psychologist, they're like, well, I don't need no medicine. I don't want no medication. Have me all fat and sloppy and sitting on the couch. And that's another thing that they think that the medication does, right? Because those they see that may take it, that may be a side effect of the medication. So thank you so much for asking that, because the behavioral therapists, if anybody is looking for a change in profession, are needed. Behavioral therapists are needed. That's where I have a hard time getting my patients into, and I am not afforded the time to counsel in my office, right? I have a certain amount of time I have to see you. And a lot of times you need more than that. So my people are there late because I want to give them that. But behavioral therapists, psychologists are much needed in our community. We have those that can prescribe, right? If that's needed to be done, we need more of them too. But the way it's set up, honestly, I'll let you know. Psychiatrist, if you're going to see a psychiatrist, it's a 15-minute appointment. You're going in there to get your meds refilled. You got any symptoms, side effects? You good? Oh, okay. That's what you're there for. Okay, get your meds and you're out the door. And you think that you come in there to have a whole hour. Not with a psychiatrist 9 times out of 10, unless you're paying that good money. But if you're using that insurance that we got, you getting a 15-minute appointment and a refill on your med. Psychologists, that's that 45 minutes. Behavioral therapists, that's another one. But we have some amazing nurse practitioners that are breaking the mold, that have different models, and that are out here afforded to the patients. But patients have to understand that they don't make a lot of money. They do their job because they really want to make a difference. They like what they do. They want to make a difference in their community, because reimbursement is very low. It's nothing like it used to be, like we used to see on TV. See 2 patients play golf on Wednesdays. That's what I thought was great too.
But hold on. Okay, so since you mentioned, we do have another question, but since you mentioned about insurance and the money, the cost of the aspect of care, right? Can we touch on something that you brought to my attention some years ago, and I just recently reached out to an endocrinologist who wanted to put me on the concierge plan. And I don't know if anyone else heard about this, but I know you have. So the concierge plan is like for rich people, kind
No,
of
it's
sort
not.
of.
Don't do that.
I know, you're right.
They can go ahead and get all this other stuff.
So you know how you call, you have your regular insurance and you call your doctor and you want to go see your doctor and your doctor say, okay, it's May, or what are we in? What month are we in? April. It's April, but we can see you in November. Well, with concierge, you want to explain how that goes?
So with my concierge, they have me almost 24 hours. When I'm not sleeping, it's the only time that they can't get in touch with me. They have my cell phone number, and they pay for that. So I go to their house, everything is done there, right? Or at their office, wherever they want to meet me, if they have an appointment, if they need an appointment. So that's what concierge is.
It's a membership.
It's a membership.
You pay annually.
You pay annually. I use insurance to cover your scripts, your images, anything like that that's needed, or if I need to refer you somewhere. But for me, it just affords me the opportunity to really do what I love to do, and that is change, right? And that's prevention. So we can prevention and we can mitigate. There's many of these things that doesn't have to happen. And it affords me the opportunity to do that.
Okay, Ryan, would you like to read the?
Okay, we have another question.
Thank you for that.
With the increasing use of artificial intelligence, how do you approach people self-diagnosing?
I'm going to say this, and then so anyone's can answer. So my son told me that I will never be younger than I am in this moment, right? And AI will never be dumber. So I need to see how I can embrace this and make it work for me. So people self-diagnosing. AI is AI is very smart. But you still need the MRI. I mean, is it your hip or is it your groin? It's in that area. But is it my hip or my groin? I mean, unless, and I'm sure this is going to happen one day, you can take your little phone and get you a scan. I'm sure that's coming. But it's already here. It's just not on our phones. We know that, y'all know that's already, I mean, MRI is it, but there are clinics that are here that you walk through the scan, and it can give you a whole body scan. So that's happening. But there's some things that AI can't do right now. And the way the insurance reimbursement is set up, I gotta see you if I'm seeing people with insurance. They have to be seen in person. So that's going to change. I mean, as we evolve and learn to use AI to our advantage, that's going to change. But yes, they do. I love it though. I love my patients coming in. I love them educated. I do. They teach me some things sometimes
I love
that I don't. Trina, we've talked, and
yeah.
I'm like, I got to go up here and research this stuff this girl's saying, because I honestly can't give her an answer right now because she gets into it. I love my patients coming in educated and us having that conversation, because I know they're vested, and this is something that they're trying to control or change, or what that looks like. So I'm not intimidated ever by my patient coming in asking questions, good, bad, or indifferent.
So when you don't give her the answer, she come to me. So I guess, we just knew.
We got tag team.
We got tag team and everything. But for me on that, I'm on the same lines. There are certain things that AI will just not be able to do. Yes, computers and everything is getting more advanced, but when you're talking about that mental health capacity, being able to have that empathy for you, I don't know. That's why I'm here. That's why I'm here, and I'll probably be long gone if a computer can ever do that. Most of us will not even be here because they're trying to make them smarter, trying to make them faster. But I always caution the ones who come in educated, and I listen to them. Once again, I don't minimize what they have learned. I encourage them to learn. That's what we said. We want you to learn, but I always tell them, be careful. Everything you see on the internet ain't always true. Then what I will do is I will even encourage somebody who did the study. How long has that study been out? Yesterday. And who paid for the study? So normally what happens is there's a 10-year cycle when they start validating things. Something have to be out and proven over or under proven 10 years. So normally that's where the basis that we look at is how long has something been out to say, and who backed it and who's supporting it and where you're getting your information from. So you always want to make sure that they're educated coming in, but I kind of just have to sometimes uneducate them and then re-educate them. I do not take insurance because, as you said, yes, I would be limited to a certain time frame. During COVID, a lot of professionals were able to do that Zoom, telehealth and everything like that, but I'm old school. I don't care for Dr. Phil or anything. I may be on somebody's couch. If y'all want me, I can be on your couch. But I will not be a Dr. Phil and I will not be a Dr. Oz or anything. I believe in seeing a person. I need to see you. I need to know if this person is fidgeting, what's going on. And even when I do offer virtual counseling, the camera has to be on. You have to be by yourself. I need to see what you are doing, because just like we do in anything else, you got the camera off, doing all type of things, ain't listening and stuff like that. So when I do entertain that, they have to come in person first, have to do the assessment, see if they are suited, because not everybody's suited for virtual. I don't care what you want. You're not going to get it with me because I'm not going to help you. And then you go and say, oh, that Dr. Walker didn't help me. Well, I already knew that virtual wasn't going to work for you. So I will not take on somebody that way. And then also make sure that I keep myself in check, that I don't have no counter transference going on to find out what somebody's going on. And that's the only way I can really do is having somebody come in first, being able to give them more than an hour and a half. And so by not taking insurance and not having to worry to be such, in those constraints and stuff. And yes, we do need more providers. We need coaches, to flip, just take, a couple more credits or something. And before you know it, you already got it. They just want you to put a stamp on it. And I don't believe you have to really have those degrees in education if you can relate to somebody. But if that's what they want, and certainly if it put a little bit more pocket change, because that's the other thing, it is expensive. It is expensive. What we do it because we want to. So that meant somewhere down the line, when I was 13, I knew I was going to go in psychology. Remember I said I was dyslexic, right? So I knew what I was putting myself into. I knew that I was going to have to study courses. I knew that I had to prove myself. So when you come into the counseling, and while we have some of that stigma of saying, oh, we don't have the money and everything, you're not paying me to make me rich. Most definitely, I'm not getting rich no time soon. You're paying me because I decided that I wanted to help. And I went and took the training. And all that time that I took, now I'm turning around and I'm giving it to you. Because it's not so easy. We have to go through that intake. We have to do the assessment. We have to research. We put ourselves back in school each and every time we see somebody, because everybody's not the same. May have the same diagnosis, but it's not the same. So we have to go back, pull out that DSM book, have to read it and go through the rule out and see what spectrum they're on. That's what you're paying for, because I'm here to help you. And with me, I try to make sure that I stay within. Since I don't take insurance, I normally make it up to a copay. But if your insurance will pick up this half and this is what you would be paying out of your pocket, then that way I can stay even keel with somebody and provide the help for them. Or I'll do a sliding scale. I have had, especially domestic violence, I just, cannot turn somebody away. I'll help them to where I can help them. And if that means a sliding scale, then I'll do the sliding scale until I can get them where they need to be.
So you're saying that AI cannot be our therapist?
AI is getting smart, and there's things that it can do, and you can learn from. I will not say that. I will not going up against Watson, wherever you are. I'm not talking about. I don't care what she's saying. I'm not saying that. I gotta go home, and I do get Alexa. So she's like, "Put you on that podcast."
Okay, we have another question. This question may be for you, Miss Alicia. Is it an issue if a person goes from being obsessed in a relationship to completely uninterested once you get the person? And how does one address losing interest and finding every little thing that's wrong to end the relationship for fear of commitment?
We're going to let you take that one.
Wow, it's such a layered question.
Yes. Okay. Let's do the
so
part at a time.
So that's, if you can just go back to the first part.
Okay. Is it an issue if a person goes from being obsessed in a relationship to completely uninterested once they get the person?
Is it an issue? It can become an issue because first you have to find out. Well, when relationships first, if it's a new relationship, the person, whether it's a male or female, they're in a new relationship, it can be some obsessive behavior because they're interested, they're trying to get to know you, they're courting you, they're trying to get your attention. And then once you agree to be in that relationship, you're saying that person can become uninterested. The question is, why are they becoming uninterested? And you have to ask your partner that you're in that relationship with, keep the communication lines open and ask why. Because you can't figure it out yourself. You can't get inside of another person's mind or head to figure out, why they don't see you the same. Is it because I gained weight? Or is it because I don't keep myself up anymore? People lose interest for so many different reasons. And I think if you're able to communicate with your spouse or your partner, your mate in that relationship to figure out what caused them to lose interest, I think that's the best way to approach it. And a lot of times people are too afraid to ask why. They're afraid of running a person away. Like, if I start questioning them too much, is he still going to like me? So I think it's better just to ask them, why are you no longer taking me out? Why are we no longer going on dates? And then you also have to look at the reflection in the mirror at yourself and see, is it anything that you can do differently? Because you can't make a person want you. I think I always say that the best relationship in the world to me is the one that you have with God first. So that's the best relationship in the world. But you have to get in tune with yourself first, because a lot of times we lose ourselves in a relationship very fast. We can lose ourselves, and you have to keep yourself active, healthy, I always say attractive. People look at attractive, in different ways. If that person that you were dating saw you as, beautiful and elegant and, sexy, and they got used to you keeping your hair done, wearing a little makeup, dressing a certain way, and then you no longer do that, sometimes they can lose interest. So I think keeping yourself together and your mental health too is important.
So you telling me I gotta go to sleep looking like a queen? No, I'm joking.
Not exactly.
That's exactly what she's saying.
Whatever they were doing to get them, they can't afford to do it to keep them. I'm just gonna say. I'm just gonna put it out.
Or they found someone else.
I mean,
They just want you on their line.
But the biggest question is why, and that's why it's important to communicate with your partner to figure out
do we really care why? Just let them go.
Well,
What
in
did
the
you say?
words of my husband, as he have said, it's all about the chase.
Yes.
Some
Yes. It is.
just want, they all geared up for something that they can't have initially, and once they got it, I'm not interested in. Not that he said that to me, of course. I'm not. He's talking about other people, but no, but that's what interesting. Some people just thrive off of that, and what Trina mentioned too, afraid of commitment. Some people just, they're not going to be committed, but they get riled up about that chase. So,
But the question you have to ask yourself after the chase, if you're not keeping the communication lines open to see where the relationship is going from the beginning, because you should be dating with a purpose.
yeah,
Not just
Amen.
dating without a plan. You dating just to have fun. You get to a certain
that's true.
age, you dating with a purpose. You're not dating to have fun or
Supposed to.
dating casually. Right, exactly. So I think the most important thing, if you got to be dating with a purpose.
You have another question?
I do. I have another question. How do you tell a friend you can no longer listen to their questions? Oh, I'm sorry. Excuse me. How do you tell a friend you can no longer listen to their problems because of the negativity that spill over from the issues they are dealing with?
Yeah, I'll take that one. No, I'm joking. Anyone else?
Well, I just want to say to that I think the most important thing with whether a friendship or relationship, whether it's a friendship or relationship or business relationship, you have to protect your peace. And you have to deal with people that match your energy. So if they're not matching your energy and you feel like they're negative, because some people, you could be having a great day and somebody can call you and drop all their problems in your lap. And now your whole mental state has been shifted because you have now taken on their problems have now become your problems. So now you have to deal with that. So I think my biggest thing is to protect your peace and only surround yourself by positive, influential people that can match your energy. So that's.
But what if they're a close friend and they really need to get some things off their chest?
Honesty is the best policy. I get it I get it, and I give it too, right? And it has to be like, okay, so I really don't want to hear about this anymore. It seems like we're going in circles. So if you're trying to do something different, then maybe we can talk. But what I'm here, politely be honest. And honesty, if that's your friend, honesty is the best policy. It's hard to do that with friends, though, but if that's your friend, they'll understand you also. So they'll know you well enough to understand that, too. So if it's a friend that's coming to you with her issues about her man, that he keep doing the same thing over and over,
And she's still there.
then, can we not talk about him today? That's just an honest question. Can we not talk about that today?
I have a problem. I would say, y'all know me, and it comes from a place of love. Girl, you still dealing with that mess? Don't call me about that stuff. If you're not gonna make any changes, I don't want to hear nothing else about it. That's just me. That's how I would approach it. But that's I wouldn't say it's right. But I'm being honest. It's like, look, what are you gonna do differently? You're in the same place you were in last year. What do you think is going to happen next year if you continue to be in that same space? I'm just honest.
Emotional roller coaster.
Really?
No, but I don't want I struggle with that too, because I don't want them to be in a place where they need someone to talk to and listen to them, and I'm not available for them. Sometimes they just need to talk.
But like she was saying, what's that, codependency? If you continue to allow them to keep telling you the
Enabler.
same stuff. Enabler. That's what it is. Enabler.
So what am I enabling by listening?
Nothing.
What am I enabling by listening? Now, if I was riding you over there so that you could see if somebody's over there and the car's outside and this, that, and the third,
That's
I'm enabling. I'm enabling.
Come on, girl, we gonna go. Come on,
Yes,
I got you. Come on,
I'm
boo.
enabling.
Come on.
But if I'm not, if I'm listening, but a lot of times you have to be honest about your mental health also and protect yourself too, and just say that, I think we've been talking about the same thing for the past 3 weeks. What we doing different?
Come on.
What we doing different? If we doing something different, then let's go. But I'm gonna have to sit here and hear about his child coming over there, slamming doors, not doing this, not. You understand what I'm saying?
Yes.
These are some of the things. So,
Or it could be a woman doing the same thing to a guy.
absolutely. This is vice versa. Yeah, this is.
Oh, now
yeah.
you sound like a man. You just want to jump
Hey,
in.
I told you.
Oh no, hold on. Let me tell you something.
She has brothers.
I grew up with all men too. I have been told that I have the male energy and I could be a little bit more feminine also. But I embrace my femininity, so I don't know what that was about. But so I hear you. I understand what that's like. Chuck it up and all that other stuff. Yeah.
Well, what I say to him, I was like, who do you want? Do you want the friend? Do you want the therapist? Or what? You just want me to listen to you because I'm all those people in one. So if you're going to talk to me, do you want the solution? And if you want the solution, you're going to give the solution. We work it out. But after a while, you have to just say, you know what? Hey, we've been down this road. We've been down this road. You find something to do. I call you back, let me do such and stuff like that. Because as you said, the most important thing is that you don't want your friend, especially a very close friend, think that you're not there for them. But you do have to protect your mental capacity because, everybody's independent now. Be your authentic self. Well, it goes both ways. You be independent. Cut that loose. What more do I have to say?
Right.
You said you're independent. Where are we going? So you get into those conversations and you don't want to get into those conversations. So eventually you just say, I'm here to listen to you. But for me, I just ask, who do you want right now? Because I'm tied up in all three of them. And if you're talking to me, I already got the answer and the solution. Do you want it now? Or do you want me to listen to you? Which one you want? I have to be honest. Because a lot of times people come to me and say, why you psychoanalyze me? I said, you're not paying me. So I'm not psychoanalyzing you. I'm just asking.
I've heard that before.
We've been together for 20 years and everything. I owe you.
Oh.
But yeah, you got to protect yourself.
Before we move on to another inbox question, I know we have a lot of veteran listeners. So I want to address this question to both of you since you work with veterans, and anyone can answer it. But one of the things is, in your experience, what are the barriers and stigma within military culture that affects veterans' willingness to seek help? And when I speak of veterans, I'm not only just talking about military, I'm also talking about people that work for the federal government. Let's say what they're going through right now, as you had mentioned earlier about the increase in depression. And a lot of that may be stemming from what's going on. I won't mention the name, or what caused a lot of this to happen. So, so what are some of the barriers and stigmas that's within that culture that affect them, the willingness to seek help?
That's a loaded question. And I work with both capacities. Thankfully, I'm not at the federal government now. I'm going through that situation because that's a whole nother, something has never been dealt with before. So I'm going to go with the military part first. As a veteran, it's his own, being in the military is his own unique organization. As a special people, you have to fit a certain mode just to get in. You can't have any blemishes, I had an impact wisdom tooth. They said, oh no, you can't get in. I had to gain weight, believe it or not, to get in. So, but I took care of all of that and I was able to get in. I say that to say is that to have any type of blemish on you, you're going in, you have a duty, no matter what your MOS is.
Military occupation specialty.
I'm sorry, yes.
Specialty.
Thank you. Your first mission is to defend, whatever capacity that is. So you have that position that you have to uphold, whether you in combat zone, non-combat zone, you're trained to defend, you're trained to go to war, no matter what your, capacity is. So you don't have the thought process to even have a mental problem. You can't have a mental issue because you got all this on your shoulder. This is what you joined. I mean, most of us was volunteered, I didn't do the draft, but we volunteered to do this. So the expectation level is up there. So when you get in these situations where once you come back home, it's a whole new world. It's totally different. I mean, you have your battle buddy, which is the person who's going to protect you whether you live or die. You have this trust circle. Trust that you're used to depend on. You have a support system where they feed you, they clothe you, they shelter you, they do all this. So now you come back home.
Give you health care.
I have to pay for that clothes. Well, the uniform. But anyway, I mean, it's just a whole new world when you come home. Now, I'm back, and that relationship is not there. That support is not there, and I got to deal with getting a job, which may not be there. Just not always the support. Veterans are starting to get more support now, which I'm glad to see. But especially like during Desert Storm and Desert Shield when I was in, when they came home, they didn't get that support.
Wow.
They didn't have a lot for jobs, health care, all that. So that can put you in a whole different mental state.
Yeah.
So with that, and I'm
Yeah.
yes, not appreciated. You know, people, you know, they say they do, but overall across the board is not showing that appreciation. I am glad to see there are more veteran programs. There are more, they're getting their disability now that they should have gotten a long time ago. When we was exposed to all those chemicals and all that stuff, we on getting shot with all kind of needles that you didn't know what was going. They talking about COVID
But
shot.
With
But-
that being said, though,
Mhm.
right? Let's go with this. While we're in the military
Mm-hmm.
and we feeling an ailment or something, or we break our leg, we better not go to sick call and get
Nope.
a profile.
No, because you're labeled now,
That's right. That's right.
and you could be put out.
Sick call is going to medical care, going to a hospital, seeing a doctor. If you, let me see, give you an example. We're out training and we fall and hurt our leg and we're in pain. Better not go to sick call. You better keep it moving and keep it hiking,
Yeah.
because if you get a profile, you, like you say, possibly get, sent out of the military. Now coming out of the military, now you want to go for your disability. But you never went to sick call
Never.
to let somebody know you hurt your leg.
Mm-hmm.
Yeah.
Like I did.
Home, telling your kids to suck it up and putting
Yep.
that trauma on them.
Yeah, exactly right.
Bringing it
Right.
all back. I'm just
That's
bringing
right.
it all
It's a
back.
full
I'm just bringing it
circle.
all.
It is a full circle.
Yeah. Yeah.
So, and with I can't even address the federal
Yeah,
government
okay.
right now. I have friends that still was at Social Security. I work for VA too, and it is total stress. We actually lost at Social Security. I know some people have heard. She had a heart attack at her desk. Soon as they came out with those announcements, with Doge, Social Security, because federal government, you always told,
You're
it's
safe.
secure, you're safe. So now you're no longer safe,
Like in the
and,
military.
like the military. So it causes a lot of trauma. Did I answer your question? I said a lot, but but how we deal with that is tough, and this is where you guys come in, because it's going to be a lot more of it, because they just starting with the federal government now, so it hasn't really hit.
Well, for us here, I just learned that only 3% of the federal government is in D.C., or is it 3 to 8%? The rest of it is outside of the district.
I was not aware of that.
Yes. So,
Does that include the DMV area or just DC?
DMV area.
The whole DMV area.
Yeah. Most of our government is out. Because I am in D.C., and that's all I see. I'm thinking everyone's the feds, right? Like everyone works for the feds. Like this is the biggest.
But what about contractors? Because there's a lot of contractors.
No, we have a lot
too.
of. There's a lot of contractors also. Yeah.
Yeah.
But I did not realize until this that most of them, because I'm waiting for this influx of
Yeah.
people that I have to see pro bono, right? Because you're using your insurance.
Yeah.
You may in turn get state insurance and things like that, right? So being willing to see my friends who have lost their job
Yeah.
that have state insurance and how I'm going to deal with this, right?
Mm-hmm.
But I was expecting more of an influx, and I was preparing myself for that. And that's when I realized that it's spread out throughout the states. I
think
didn't
you're still
realize
gonna
that.
get it though. It hasn't really hit. Yeah, and I think it's.
Oh no, I've increased, but not the influx that I was expecting at the rate USAID. You know, I wasn't. I was expecting to be like, girl, I gotta send. You know, refer. That's the only reason I said that, because I didn't realize that most of the government sits outside of the district.
I would like to also kind of go back to what you were saying about the children having the stomach ache and the headache and it stemming from mental health. So how does, which you already touched on, but let's go a little deeper, how does an individual's mental health affect their physical health and wellness? Because like what she just mentioned, that, mentally, the lady was at Social Security, she heard about what was getting ready to come down, mentally made her have a heart attack.
Well, I don't know her background and what she was dealing with
True.
before that, right? Or where she was at that moment that she had a heart attack. So, it affects everything, right?
Mhm.
It affects the way you look, right? You may not,
like that.
like she said, they may not be cute anymore, or
Right.
they're not taking care, they're not getting their nails, their hair, whatever. For us, the men getting their hair cut. They may withdraw,
Mhm.
irritable. So whoever asked that question, that could be a mental health question initially that you asked, right? They're withdrawing. So they won't come to the doctors. Come for what? What am I going for? The doctors is their lowest priority at that time, because if it's so severe, they've lost housing, they're not eating. These are the main staples, right? So they've lost housing, they're not eating, they're not getting paid, whatever that may look like.
Mhm.
So that's, how it can affect you. You can lose your job because you're not taking care of your mental health. You're stressing. Someone has you stressing their home, your parents, your children, your siblings, your loved ones. You carry that to work, right? And then you don't know that you really can't see yourself, right? But someone sees you. So if they have mental health first aid, right? And that algae, they see if this is a cute situation, and they're listening, they give some encouragement, and then you refer. So those things, it plays a role with me when they come in to see me, and they answer a questionnaire, or I'll say something like, have you, how many times this week have you felt really low or down, right?
Mhm.
Once, not at all. More than 2 times, 3 to 5 times, right? How many times this week have you just wanted to sleep and stay in bed, right? These are just general questions that we ask at your annual physical, and from those questionnaires, you can be able to pick up things, and that's screening and mitigation and prevention. But if they're not, your brain controls everything about you.
True. Yeah.
So if this ain't right, this not gonna be right.
Mm-hmm. And that's
That's
what a
how
lot
it
of people
affects
need
it.
to
So
know.
at school, the grades are poor, different things like that. Sometimes for us adults, we just need to step back, evaluate the situation, and then come back to it.
Okay. When you mentioned schools, I did have a really good question about that, about how our schools and everything could help.
ACE
Okay.
screening is how they help. They're not there, 400 to 2,000 kids screenings, right? It's not hard to do.
Going back to ACE and behavior therapy, what are alternative methods such as art therapy that you can recommend to the community?
It depends on the diagnosis, what's going to be effective for the person. So there are things out here for we have many not many, well, we have more therapists and businesses popping up. Popping up to assist the patients. I hear what you're saying, Ryan. I think I'm inferring what you're saying. But I wouldn't be
Let me
able to
help you
give
out on
you
that.
Yeah, I wouldn't be able
So-
to give you that unless I knew what was going on with the
That
person.
is something that I actually had saw and that I'm moving into the realm long time ago, before even getting my degrees. Each of us have to go through our own therapy. You can't give therapy if you haven't went through therapy, and then that's one of my the psychologist that I saw at that time, because it was in the hospital, it's military, so I got it free. So I didn't have to pay for that for school and everything, and that's what he told me to move into, and that was over 20 something years. But with me moving with my husband all the time and everything, I never had time to plant my roots and everything, but been dabbling in and offering more of what. Remember I said how you got to get somebody to a place where they're not knowing that they're going through the counseling. And as she said, you can't do it with everybody, but you can do it with some. But I like doing it with couples, because when the couples finish the art, I have to set it up, so I haven't done it as much because I have to trigger the pattern to what's going on. And then once you put it together, it's a puzzle by how they respond to the questions that were asked, how they marked it, how they identified it, what color they put. Then that way they have a conversation about that piece based upon what they said and what I have watched and I assessed them to do. So a lot of people are going more into the art therapy and everything. It's just another way of engaging. There's so many different tools that are going. They have games. They have couples come and do games. So people are just trying to get creative, and that doesn't require, to have a degree and everything like that. Children. Mostly you'll do your art therapy with the children because that's one way you can have that relationship with them while they're drawing, while they're talking to you and everything like that. So I'm a component for it because I know that's the direction that I will be going into too. I want people to come and be relaxed. And then I want them to actually tell me and describe your art. Who are you? And the best way to do that is through art therapy.
Okay.
So let me say this. So different. So she just triggered something. So ketamine therapy, mushroom therapy. I mean, it depends on your diagnoses, right? We're using more mushrooms and ketamine for hallucinations, schizophrenia, extreme bipolar. So our education may have us looking at things a little differently, right? So when you said that, so my thesis, my dissertation is on cognitive behavioral therapy. I'm a big believer in the way you think, the way you feel, and the way you act, any of those orders. And if it's something that is negative or a crisis or danger to you, if we can cut that chain somewhere, it would change the outcome, right? And I did this with chronic pain, right? So there are different therapies out there, but a therapy is very specific, right? It's custom and specialized to what your need is, right? So it may be art therapy for couples, and she finds that that's good, recreational therapy, music therapy, but for mental health, we're dabbling more into the ketamine therapy, the mushroom therapy.
I want to give thanks to one of our sponsors, Chickalicious. The guests and I have been grubbing down on some delicious chicken here tonight. Wasn't this food delicious, you guys? Food delicious, right? All right.
They come with their own special sauce.
Come with their own special
so
sauce.
saucy.
You see, I'm so saucy.
I'm so saucy. I love sauce. So they come with their own special sauce. You can eat it with the fries. You can keep it, take it home, eat it with your crabs that you're going to get this weekend. It's
Awesome.
nice.
Oh. Oh, are we?
We can
With
do
the good girlfriends, are we doing crabs this weekend? Is it in season?
Yes.
Oh, okay.
I love it.
Please remember to use your mic.
I will. Bedside Baptist.
Okay, you guys, we're going to do the raffle, and then we'll do what we call the trivia. And just to explain, yes, I do. Yes, we do. Okay. You got yours on your side. I got mine on my side. Really? Yes, ma'am. Yep. And you're going to grab yours, and I'll grab mine. Yep.
Okay.
Okay, here we go. All right. I'm going to shake this up, and I'm going to pass it to one of the panelists to pull out a name. If it's your card, please come up and get your gift. Okay, first one. Oh, wait a minute. Okay, go ahead. I don't know.
Did everyone put a card in there? No. Did you even write your name down and fold it up and put it in?
Oh! Khadijah, please come up and grab your gift.
Here.
You can come here.
Thank you.
Ryan said she was gonna get up, but you know how that goes.
Appreciate you.
Mm-hmm.
Thank you, HoneyChildListen.
You're welcome. Yay. Okay, we're gonna pull out another one. Elena, would you like to pull the second card?
Yeah, let me go to the bottom. I know some people don't wrote them, but let me go to the one that got a card. I'm pulling from the middle. Okay.
She got a bigger fishbowl. Your mic, your mic, your mic, your mic, your mic. Arnett.
Thank you, HoneyChildListen. Thank
Thank
you.
you.
SRG.
You're welcome. You're welcome. All right, let's get Dr. Walker to go ahead and pull the next one. Oh, please use your mic, Dr. Walker, please.
Does this says Blue View Landscaping? Come on up.
I'm trying to give something. Oh, man, there you go. Thank you. Thank you for coming.
Thank you.
Okay, who has the jar? Okay.
Trying to grab something. Thanks. All right. Something that I can read since I don't have my glasses. Sampson Properties, Lisa Tolson. My name. Lisa, where are you? All right. You have such a nice name.
Hey, Lisa, you might, if you check with Victor, see if Victor wants to switch with you.
Oh, come on.
We have to have this type of conversation. The community needs these answers from all of our professionals and our community members. So let's get right back into it, okay? So we're going to start with the questions from our inbox. Oh, do you have them? I don't. Okay. Here we go. We have a few questions in the inbox from our listeners. And our first question is,
How can I let go of a marriage that no longer fulfills me?
come
Oh,
on,
wow.
that's what I'm talking about, real talk. Come on.
Walker.
Oh, wow.
That's not.
But that's okay.
I'm only joking.
I would just say,
Go ahead. Yeah, come on.
we have no words.
I want to say thank you for the question.
Yes, thank you.
First of all, no one should ever be afraid to say what they need to say. So just like you have posed the question here, have that conversation with your spouse. It's not fair to you. It's not fair to them. So if that's how you truly feel, make sure that's how you truly feel and have that conversation. But before y'all just decide to sever, I would say come in, talk with a professional, because just because you no longer have that feeling, what about the other person may have some feelings too? So we want to make sure that it is a healthy separation. Then that way there won't be any regret, no repercussions, and then that person will have the opportunity to have his or her feelings validated as well too. Because sometimes if you feel that way, the other person may feel that way, but by you being honest and speaking up, you may have just, done it. But for me, what I always tell people is I'm not here to break up relationships. I'm here to save it as much as I possibly can. But if you truly, truly know this is not for you anymore, I will help as well too. So then that way it can be a safe and harmonious, balanced relationship.
Okay, wait a minute. On that same line, the question is, what tools or strategies help couples with judgment-free conversations about mental health? Because that's one of the things you said. You said to have that conversation with that person. So what tools and what strategies, when you sit down, you want to have a conversation, what kind of tools can you use and what would that strategy look like?
Well, each tool is going to be different according to what they say to me. So I can't give you a blanket one outside of the communication, because if you don't have communication, there's no tools I can give. So once they tell me what the issue and what the situation is, then that's what tools that is going to be assessed to them. This is not OJ. You know, if it glove fit, no. Everybody has a different tool based upon the relationship that they're either trying to save or that they're trying to separate from. But most of the time it's listening, being honest, having that communication, and then also making sure, as we all have said, and if we haven't said it, and if we didn't say it enough, you have to have self-love within yourself. You got to know it's okay to have your feelings, and it's all right, and nobody can tell you, whether it's spouse or not, that you can't and that you don't have those feelings. So just knowing to make sure that you balance yourself. I always tell a person, make sure you ground yourself before you open up the mouth.
But the question,
Because words are bullets, and they cannot be retrieved, and they often hit individuals that you did not mean to hit. What was you going to say?
so going back to the question, right? So going back to the question where this person said, because I want this person to walk away with something, right? You said a lot.
Are you trying to control this relationship?
No,
You can't control the relationship.
no, I'm just saying the question says, how can I let go of a marriage that no longer fulfills me? And I think the person is asking, how can they walk away? Not how can they have a conversation with the person and say, hey, I'm leaving you. They want to know mentally, I don't know, I could be wrong. They want to know mentally, how can they prepare themselves to walk away from a situation that's no longer fulfilling them?
So that's when I would bring that person in and we would talk about it. But once again, as I told you before, and you know me, Katrina, I'm not going to give a blanket
I
statement.
know, that's true.
But if they need the tools, I still would need the person to come in. If it's not me or if it's anybody that they go to a health provider. They will help you. Go to a coach. They will help you with the right tools to go through. So once again, it was a wonderful question. As you see, we're here to help you, or find somebody that you can connect to. Don't just walk out and be done with it. That's not going to be healthy. That's not going to be balanced. And no, you're not going to fulfill the question that you asked for. But the only way you're going to get the tools is you have to talk to that person. You have to talk to a provider in order to get the tools that you need for yourself.
Ask the question one more time.
Okay.
Come on.
How
Hold on,
can
before you ask it. We got her professional opinion, which is awesome, and you want to listen to that.
I'm going to give another one.
I know that's what I want. I want us to dig deep and take it personal and think, okay, if I'm in a relationship and I'm not being fulfilled, what are some of the things or strategies I would do? So ask the question again. But you're right. They definitely need to seek professional help.
Oh, I know I'm right.
Oh,
Well, all right. How can I let go of a marriage that no longer fulfills me?
So they're still together.
They're still together.
They're not separated.
How can
So
I
it's
let
not
go of
this
a marriage?
mental
They're
thing.
not divorced yet.
So personally, I haven't let go of a marriage,
Okay.
right? But I've let go of a relationship.
Mm-hmm.
And I didn't seek therapy for it, which I probably should have, because the baggage that comes along with that afterwards, right? You have to deal with that.
Absolutely.
So you don't transfer that energy to somebody else.
Absolutely.
But you really know when you're done. It has to be something without inside of you, because when you leave, why come back?
Mm-hmm.
So if you leave too early, or this is impulsive, right?
Mm-hmm.
Then you'll find yourself repeating the cycle.
Mm-hmm.
When we all can think about the time where we walked away, and when we really did, that thought wasn't even there anymore. It just wasn't beneficial to us anymore.
Mm-hmm.
I don't know what turns that on in each individual person.
Okay.
You'll find people that are gluttons for punishment. Is what in my eyes,
Mm-hmm.
but that's my personal opinion, my judgment. Right? We listen, we don't judge.
Mm-hmm.
But for someone else, it may not be.
Mm-hmm.
Right? So I think that inner strength or whatever that is different for each and every one of us. So I don't know if that's just like a one, like, how do I walk away from a marriage that, because that is so financial, children, like that's professional. But we talking about a mental connection, that's internal. And you know when you walk away, because there's no more tears. It just doesn't upset you no more. Like, you really just don't care. So why am I there?
But do we know why it's no longer fulfilling us?
That's something you have to do with yourself. Like,
Right.
what
Figure
fulfills
that
me
out.
may not fulfill you.
No, but that's what we're
Right.
saying. So they have to figure out,
Yeah, that's what they have to figure.
and that's
What
they're-
was
well,
missing?
they probably
like,
already know what it is.
people looking. I mean, you know,
They may not being fulfilled sexually,
could be. I didn't.
emotionally.
They didn't
Yeah.
offer. They didn't give that
No, that's
much.
fine.
But yeah,
Right, but they're saying they're not being fulfilled. So how should they walk away? And you've given a great answer, and so has Dr. Walker.
Yeah, if they're
Yeah.
married, that's complex. They need to see you.
I would say, because I'm on my second marriage. Thankfully, I do believe in marriage, but I did walk away from my first marriage, and it was very difficult because I really believed in marriage. It was to father my child, and I did everything. I thought I did, because it's on both sides. Because you think you're doing everything right, and it's just them, but it's both sides, and we just were not compatible. What he wanted in life was different than what I wanted in life, and it was at a point where we can't go any further because we on two different paths. You going this way, you going that way. How we gonna come together? It wasn't working. So I had to realize that with all the consequences from leaving, us separating, I should say, with all that, I knew, like you said, I need to have my mental peace, my mental space. I had to be there for my daughter, because they said stay together for the children. Sometimes it's worse, and she saw that. And and I had to figure out what was really best. So we talked about it. He didn't want to do it, but he knew we was just not, it wasn't going to work. And I had to move forward. And with all the consequences with it, it was still the best thing for me. And now I'm happily married.
Thank you, women. Thank you all. Right, let's move on to the next
Before we
question.
move on to that, because you both somewhat said it, I know that was about fulfilling and everything like that. But if there's any forms of abuse, you most definitely need to get out, seek help. Okay? I don't want to move past that without making sure that you know you're not alone, and you got to make sure you're safe. And if there's children or anything involved, please make sure that they're safe.
And just to let everyone know, on our website, Maryland Human Resources, we will have resources out there that you can tap into. We're still building it, but we will have a lot of resources. We'll have all the panelists' information on there as well. So just want to let you know that.
Well, one big resource is 988. That is national. If you're in crisis, a mental health crisis, like there's 911, you dial 988. In DC, you have 844 for Help DC. 844 for Help DC. Maryland, I'm sure there is, but that 988 will touch all the states and the cities, and they will direct you. So this is for individuals in crisis, and this is for family members or loved ones that's dealing with someone in crisis. You can call the number 24/7, and that's for immediate help.
I have another question that's kind of similar to the last question. How do you move on from a person mentally? How do you just mentally just walk away?
Disconnect.
How can I disconnect?
No, that's what I'm saying. That's what they're asking. How can they disconnect? I don't know. Anyone?
Behavioral therapy, psychiatry, psychology. If they're asking that question, they're asking for help, and that's nothing I can tell you to do, right? Because I'll tell you pick up your stuff and walk out the door.
Okay.
That may
But
not
that
be
don't
appropriate
mean you
for
moved
you.
on mentally. You can pick
Right.
up your stuff and move your stuff.
Right, and then then y'all back together next week. So yeah, that's
Yeah.
they can talk to someone.
They need some healing.
Yeah.
You got to go through the healing. You got to go through the process. Yeah. That's the only way to move on is to go through the healing. Like you say, get some help, mental counseling, so that you can heal from it. That's how you seek counseling. That's how you move on. You got to heal from it first.
And you go out with your girlfriends and get some drinks and stuff and come up here.
I was going to say that too. You can just go ahead
up
and walk
outside on them days. No.
I was gonna say.
You just got to talk closer.
Also, you have to be in a mental space to move on. It's not as easy as people make it seem, like you just pick up your things and you just move on. You have to be in a mental space to move on. And a lot of times people always say, oh, I got to have a plan. I got to have a plan. You don't necessarily have to have a plan to move on, but you do have to be in your right mental state of mind before leaving, because otherwise you'll still be holding on to the memory. A lot of times people are like, oh, you could just block them out. No, it's not as easy to block somebody out. You could block them out temporarily, but if you haven't dealt with the
Trauma.
the trauma, I always say the codependency of that person, because a lot of people stay in relationships because they're codependent.
And then
on
they
that
get
person.
triggered.
Yeah.
Or they're loving someone that doesn't exist anymore, right?
True.
That person is not that person anymore.
So when you say they have to be in a mental state to move on, what does that look like? How do they get themselves into that mental state?
How do they get themselves in that mental state? Do things that make you happy as an individual, whether that's protecting your peace, whether it's seeking therapy, whether it's like Dr. Elena said, going out with your girlfriends, you hand dancing.
That's therapy. Yeah. Exercise.
You have to do
therapy.
something. Yeah, you have to do something that you enjoy in order to move on, and to protect your peace. Because I'm big on protecting your peace and putting yourself in positions where people match your energy. So,
Get another number.
I actually have a client that I'm helping. And so what we're doing is we're going through all of those things and everything. But what we're also dealing with is not beating themselves up or putting the blame on themselves of why didn't this work out, because that was not any of the issue. So some people are capable of doing it on their own. They don't always need to come into us, but if they do need to come into us, or even if it's one of you, your friends, you have to let them know it's okay. It's okay, and you have to make sure that they have a balance to know that it's not anything that they did, and that they're worthy. They're worthy of somebody. And it's not right away, not immediately, but they're worthy, and they need to be with somebody who is going to value them as well too. Because right now, that's the cycle we're going to go through. It's like I got to keep preparing for the setback. I don't want them to think it's going to happen overnight, because it's not going to happen overnight when it's mentally. When the person felt that they were the one wrong in a relationship and they weren't. So making sure that they don't put the blame on themselves and carry that on, or feel that they're not worthy or they're not attractive or anything like that. You have to have them make sure they heal themselves, so the trauma doesn't go on to the next person, or they don't repeat the next cycle and everything like that.
Okay. Co-host, what's next?
I have another question. How can I let go of the anger I have with past mates and allow myself to allow the possibility of a new relationship to flourish?
Did you say kickboxing?
Kickboxing, get that energy out.
Get that energy out.
And sometimes it is not, like I said, it's not always coming. It's not always coming to counseling. Sometimes you just gotta love yourself again. Love yourself again is the easiest tool, but I know it's hard. It's easier for me to say than be done, but sometimes that's just what it is. Find your passion, find your love, find you again. And it may be just kickboxing, it may be going out with your girl, it may be right here on the couch. We don't know what somebody's going through at any particular time. but surround yourself with people who will support you and who love you. And I'm not trying to put myself out of business, but at the same time, you don't always need to, pay to have, counseling. And sometimes it's just loving yourself and finding what makes you happy.
But that's good that you say that. And that right there, when you say, get with your girlfriends and talk, get in your safe space, and have those conversations and say, I'm not okay, right? Did you check on me? I like that song. So you gotta, go ahead.
Yeah, one thing I was going to say, when you say get with your girlfriends, talk to them, get into a safe place, a lot of times when women are going through things, they isolate themselves. They shut down. They don't want to tell anybody what they're going through. So what is the fix for that? Like you said, sometimes it's not always getting with your girlfriends, having a great time, because after the great time, that person that has those issues haven't went away. They still going home alone and dealing with them same issues. So I think, like Dr. Walker said, is getting to know who you are first, and they have to have a love affair with themselves first before they can have a love affair with anybody else. So that's how
But I will say this, not to be bragging on myself, but I'm a good friend. And when my friends come to me, like I told you, I'm so completely honest. I have a little touch of autism. So I will say what I feel and what I think. And at times it may hit the person hard, but then when they sit back and think about it, because a lot of them have come to me and say, oh my God, what you said, it really hurt me. But then I thought about it, you were right. So I think when you get with the girlfriend, you got to get the right person. And they may walk away feeling, oh my gosh, that conversation was so good because she told me the truth.
Sometimes you need a reminder of who you are.
Yes.
Who you are, because some people lose themselves in relationships, right?
I agree.
So sometimes you need a reminder, and your girlfriends can, or your male friends, they do the same thing, right? The guys, your girls or your guys, they can, remind you, or you can go out and then come back, like you said, a little bit more depressed. Come on, I mean, it just depends on who you're talking to. But loving yourself, as we all said, that's the key thing, right? Everyone doesn't love themselves. They don't.
No, they don't. And that is behavior. Everything we have been talking about is a behavior, a thought, a process that is not always intact for somebody. And sometimes it's just a matter of coming in and talking it out with somebody to find, re-evaluate yourself, rediscover yourself. And that is all behavior psychology. So when they ask the question about what are the difference between what we all do, that's what you're looking for. If it's not with your close girlfriends or something, when you do come in and you seek, either one of us or somebody else, is that you're looking for that person who's going to get you that behavior that is best for you.
I will also say is life and death in the tongue. If you start speaking negatively about yourself, and you think, oh, I'm not a good person, or I don't look good, or if you just start negatively talking about yourself, you start believing it after a while. So I think speaking positive to yourself, having some type of positive affirmations that you can say to yourself every day. What are the good things and good qualities about yourself that you love? And a lot of times people don't do that. They look at all the negative and other people's opinion of them. If they learn to not focus on other people's opinion, they'll be better off too.
I have them all over my mirror. Everything that I do or a tool that I have given a client, I have done it or experienced it too. So every mirror you go in my house has a positive affirmation on it, because you gotta remember. So every morning my husband say, hey, gorgeous.
Yes, sir.
That's less. She knows my husband.
No.
Hey, gorgeous.
Oh.
But sometimes you have to do the cheesy stuff.
Yes.
I always tell a person, don't be afraid to be cheesy, because when you make fun of somebody else's yum, you don't know what you're doing to that person.
Yes.
Sometimes they gotta be cheesy, have fun, dance in the rain. We have all those things. Why can't you do it too? And why be judged about it? If it makes you happy, You know, just be safe. Just be safe. Don't no crazy stuff.
Yeah.
You know?
Well, one of the good things that both of you guys touched on was you said it tools, and you gave a good example. The tool of changing how you think, changing your thought. Because if you are thinking, oh, I can never get this done, there's no way I can get this finished, change your thought and say, oh, I'm going to get this done. I will get this finished. And then you can accomplish it. Or, I don't know, I was trying to think of some examples that some people may say to themselves, and they're thinking negatively, but you change that negative thought into a positive one. And that's, like I said, that's a tool. People don't even know that that's a mental health tool.
You did it.
I can.
You
So
did it tonight.
yes,
I did. I was
absolutely.
going to mention that. I have been planning this for a while. Let's say years. I did it before. We started in my basement called Wind Down Wednesdays, and then I just fell off. But I'm back to stay. All right now.
So that's basically
Thank you.
cognitive therapy, right? The way you think, how you feel, how you act. The way you think, how you feel, how you act. Are those things, and you can manifest those things, as you said. So an example that you were searching for, Trina, is so pain management. I have people that I deal with chronic pain all the time, and there's a lot of literature and research that we catastrophize our pain. We do, and for many different reasons. However, so I'll give you an example. There's a woman that likes to garden, and that's her thing. That's her therapy. That's her passion. That's what she loves to do. But with her back now, she can't garden. This is what she says: I cannot do it. So I'm like, I can't do it. So how many hours were you gardening, right? Oh, I would be out there all day. And I'm like, well, I mean, we have to alter these things. You're not that person anymore. We have to accept where we are now, right? And then try to make some adjustments, right? Because you can garden for 45 minutes. And maybe you can go back out there later on if you're up to it, right? You don't have to abandon those things, right? So that's how those changes in your thought process affect your behaviors, right? And there's models out there that we use. Those are tools that we use as clinicians to help change behaviors, because pain is a big one. Mental health is one of the biggest, is the largest disability in the United States, right? That's what they show. And right behind that is chronic pain, right? So these people are depressed. They're anxious about going out and different things like that. So that I'm a big promoter of cognitive therapy, because our brain is amazing and we don't use it as much as we could. But people have to understand that what you think and what you put out in the universe, that it comes back. It comes around. So you put positive things out there, and you'll get some positive things back. They may not be the positive thing that you thought you was going to get, but it may be exactly what you need to prepare you for whatever you're getting ready to do now. So that's when you're saying our thought process, there's medical terminology for that. All right. So that's cognitive therapy, cognitive behavior, conscious behavior, right? All right. We're made of energy. Our heart is, and we're made of energy, and we transmit it. We put it out. It can be negative, it can be positive. What you put out is what you're going to get back.
Okay, that was it? Awesome. Okay. I believe we answered everyone's questions that are here tonight. What I would like to say is thank you to our incredible panelists and to everyone here tonight. Remember, mental health is health. When we support one another, we build stronger, more compassionate communities. Also, again, you guys, if you want, you can network with our panelists. Remember, their books are displayed. If you're interested in purchasing any of their books, you can definitely speak with them. How can listeners stay connected to your work or follow up for more support? Anyone?
I can be valleyhealthcare.com is my website, and you can make an appointment there, and we can talk about memberships and stuff like that. There's different things that I offer. You can go on, if you go on the website, you'll see the many things that I do. But I'm in Anacostia 2 times a week at the Big Chair, and I'm outside in the community. I'm in these streets. I'm in these streets. You can find me.
Hi, they can reach me. I am Alicia Walker, author, speaker, coach. They can follow me on X at author ASW, also on Instagram as author ASW. They can go to my website at www.authorasw.com and send an inquiry for more information. They can also make appointments for coaching on the website as well. Thank you.
Yes, I'm S.L. Walker, and you can contact me at Theories of Life, which the website is walkerandwalkerccs.com, and that is the best way to reach out to me and everything. Also, what you can do is that you can always just go to my Instagram page. It's SL_Walker_PhD, and you can follow me on Instagram every Thursday. I do Theories of Life. Theories of Thursday, that you will have some inspirational quotes and motivation to help you get through.
And I'm Lisa Walker. You can contact me on my website at mdexpresstags.com. Select Contact Us, and you put your information in. It will come directly to my email, and I can respond to your inquiry.
And you can also reach them at HoneyChildListen.
Well, actually, the website, MarylandHumanResources.org. And what our winner did not mention was that you have to scan the QR code to make the donation. So please do. I want to personally thank each and every person in this room for coming out tonight. You could have been any place tonight. It's a Friday night. It's Good Friday. But you chose to come here, and I really appreciate it. You saw the title of what we were doing, mental health. A lot of people run from it, but I appreciate you running towards it. So again, thank you. Our listeners can't see the people here in our audience, but we have a lot of people here to learn about mental health. I want to also thank our sponsors, one in particular, Chickalicious. I want to ask the audience, how was the food tonight, you guys? Yes. Thank you, Chickalicious, for coming through. Thank you so much. Hopefully you'll do the next one too. And we do have, I'm sorry, one more. Our dates will be posted on our website. I would definitely like for you to contact us, put your information in if you want to find out when upcoming events will be posted. We'll contact you. And I'm sorry, my co-host.
No, I just want to thank you all for coming out tonight. We really do appreciate you. And like she said, today is Friday, and a lot of people would like to do things, your personal time, wind down, your R&R. But I appreciate you guys sharing your spare time with us.
But wouldn't you say this is some great personal time? They came out and they yeah. This is like going to the gym. You got some good information to feed your brain for your mental health. Wouldn't you say that?
Okay.
Hey.
Not much like gym.
And
okay.
Exactly. So this is HoneyChild Listen, signing off. We would love for you to join us for the next community conversations coming up real soon at a studio near you.